Hey everyone, I'm Dr. Tyler J. Tolbert, owner of Smile Now Dental Group. Let's talk about something that doesn't get mentioned nearly enough in the world of full arch implants. Is your dentist cutting corners when it comes to your final teeth? Whether you're in the planning phase, already in your temporaries, or considering switching providers, this is something that you need to hear because the difference between good enough and done right is often huge. In this video, we'll break down the most common shortcuts we see in final prosthetics, what to watch for as a patient, and how to make sure the smile you walk out with is one that you'll love and will last. Let's define final teeth first. When we talk about final teeth in the context of full arch implant cases, we're referring to the permanent prosthetic that's placed after your healing phase is complete. This is not the temporary that you leave surgery with, it's the set of teeth you'll be using to chew, speak, and smile with for the next 15 to 25 years or maybe even longer. So what do we mean when we talk about cutting corners? We're talking about everything that goes into that final prosthetic, from design to fit to materials to follow-up care. Unfortunately, not every office takes the same level of care or precision that we do. Here are a few of the most common corner cutting practices that we see. Number one, rushing to the final too soon. Some providers place final teeth just weeks or even days after surgery without allowing for proper healing time. The bone isn't fully integrated, your implants aren't fully healed, and the soft tissue hasn't settled. Your bite and speech haven't even been tested. You haven't had the opportunity to feel things out and see how they work. You're locking in something before your body's ready and hoping it works out long term. It's a gamble. Number two, one-size-fits-all designs. Some clinics use stock designs with minimal customization. Every patient gets the same shape, color, and contour. You deserve a smile that's built to your face, not someone else's template. Number three, low-quality materials. If a clinic doesn't explain what your final teeth are made from, ask. Cheaper acrylics or resin hybrids may look fine at first, but they stain, chip, or even break over time. At Smile Now, we use high-strength zirconia because it lasts. Number four, the lack of test drives. Would you buy a car without a test drive? Then why would you accept permanent teeth without trying a prototype first? A proper workflow should include trial smile appointments, bite testing, aesthetic feedback, and the space to make changes before the final version is locked in. You should also get an opportunity to see and feel what that is like for some time before you lock in your final. Many providers skip this step entirely, and you're the one that ends up paying for it. Now here's the tricky part. Many patients don't know what to expect, so they just assume, well, hey, I guess this is how it's supposed to look or feel, and everything's gonna be fine. And by the time they realize that something's wrong, like the bite is off, the speech is affected, or they just don't like how things look, it's too late. Or they need to start over and they're gonna be paying again. You don't have to be a dental expert to ask the right questions. Just remember, you're not being picky, you're being smart. At Smile Now Dental Group, we take a no shortcuts approach to final teeth. Here's what that's going to look like. We wait until your implants are fully integrated before we go to the final. We use facial scanning and 3D planning to make sure that your smile fits you and is not a template. No two smiles are the same. We create test prosthetics so you can see, feel, give, and get feedback from others before anything's ever finalized. We hand finish every prosthetic using multi-layer zirconia for durability and natural aesthetics. We also involve you in every step because your opinion matters. This isn't fast and one and done dentistry. This is lifetime dentistry. If you're in treatment or just starting the process, here are a few questions to ask your provider. What material will my final teeth be made from? Will I get to see a prototype before final delivery? How long do you wait before going to final? Do you use a lab or design everything in-house? How are adjustments handled once my final teeth are placed? If they can't answer those questions clearly or rush through them, that's your signal to pause and consider your options. If you want final teeth that are custom, durable, and done right the first time, we'd love to help. Simply click the link in the description to schedule your free consultation at Smile Now Dental Group. We'll walk you through your options, show you real results, and make you leave with a smile that looks great, feels natural, and stands the test of time. Thanks for watching, and don't forget to like and subscribe for more no-fluff dental insights to help you make confident choices. See you in the next video.